DOLA patient-ready orthotics. The orthotics podiatrists use. A collection of our 9 most popular and proven prescriptions developed from over 50 years of clinical and orthotic experience. Patient-specific styles, ready to fit in clinic, orthotics for health professionals only. The lateral patient-ready orthotic is designed for patients showing signs and symptoms of pathomechanics of the lateral foot and leg. This video will help you identify which of your patients will benefit from adding the lateral orthotic to their treatment plan. What type of foot will it help? What does it look like and how does it function? What conditions will it help? And why will this patient-ready orthotic help your patients? Your patient may present with many pathologies of the lateral foot or leg, including general lateral foot pain or pathology from an injury, overuse, osteoarthritis, or related to a disease process. Peroneal pathologies, lateral column pathologies, including stress reactions, ligament injury, and cuboid syndrome, or chronic lateral ankle instability. Lateral pathologies can be linked to different foot types, gait patterns, and pathomechanical function, including the supinated or pes cavus foot, the pronated or flat foot, sagittal plane blocks, and even the relatively normal or neutral foot. Pathomechanics may include a lateral or low gear toe-off pattern with avoidance of first MPJ or high gear toe-off, or various proximal chain compensations. This is often related to functional hallux limitus or impaired propulsion or windlass function. On functional examination of the windlass mechanism with Jack's test, results may include a reduced range of motion compared to non-weight bearing, high force needed for activation, or a delay in initiation. Local and proximal compensations may include adduction of the leg with lateral toe-off causing an increased load time and force on the lateral foot, lateral instability, poor proprioception, and high peroneal activation for balance, frontal plane stabilization, and first ray plantar flexion, as well as increased loading of the lateral foot, may relate to the presenting pathologies. A more rigid foot with limited rear foot or subtalar joint eversion, poor shock absorption, or restricted ankle range of motion may also increase the tissue stress on the lateral foot structures beyond their functional capacity. Mistimed gait events may also contribute to the pathomechanics, including heel strike, prolonged lateral loading, low gear toe-off or lateral toe-off, and impaired propulsion and windlass. The signs may already be there in your current treatments, giving you confidence that the lateral orthotic will help your patient. Have you had success with taping, lateral ankle or foot taping, a footwear change to a more supportive or cushioned style, a stretching or strengthening program, improved capacity of the pathological tissue, or treatment-directed testing of lateral wedging or a lateral arch pad, or has your patient had previous insoles? All of these may indicate that the patient-ready lateral orthotic will be a successful option. So how does the patient-ready lateral orthotic help my patient? This orthotic is specifically designed for patients with lateral foot, lateral ankle, or peroneal pathologies to address the most common pathomechanical causes. Stable rear foot control. The rear foot platform provides stability for the transition from heel strike to mid-stance. The medial arch support provides support for the medial arch for transition from mid-stance into propulsion, improves the windlass activation, forefoot stability, and promotes high gear toe-off. The lateral arch cushioning and contour provides increased lateral arch support, improves shock absorption, stabilizes the foot, and promotes medial transition to propulsion. The lateral wedge improves lateral stability and medial transition to propulsion. The moderate heel raise improves sagittal plane transition from mid-stance to propulsion and addresses any ankle equinus. The full-length performance EVA shell provides the combination of cushioning and control this foot needs. And the luxury DuraFit top cover is designed for both daily and sporting activities. For more options to fix the feet that walk into your clinic every day, see the full patient-ready range and be sure to check out the rest of the training modules. Need help finding the right orthotic for your patient? Use our online Orthotic Selector tool. Tell us about your patient, their activity level, pathology or lifestyle and performance goals, their foot type, clinical test results, and we will recommend the best patient-ready orthotic from our range. For daily education and training, follow us on social media, including Facebook and Instagram. Subscribe to our YouTube channel, follow us on LinkedIn, or visit dollarorthotics.com.